guys, it's me, Ariel. Sorry it's been a while since my last video. I got super distracted with life, the MCAT, applying to medical schools, and all that fun stuff, so I do apologize. I meant to make another video months ago, but here I am. So as promised, I'm going to make a video today talking about how to become a medical scribe, what it's like to be a medical scribe, and just kind of focusing on that for today's video. So I wanted to start out this video by mentioning that there are several medical scribe companies throughout the U.S. A few of them that I know of are ProScribe, which I'm currently working for right now. There's also Elite Medical Scribes, Physicist Scribes, and Scribe America. Those are just a few that either my friends have worked for or I just happen to have stumbled upon through internet searches. All of those, I believe, you do apply online. It's an online application, and they tend to want to hire students who are pre-med, pre-nursing, pre-dental, anything related to the medical field, because they know that you're interested in that kind of thing, and it's a benefit for you because it does give you an edge up on the competition application-wise. It definitely does, and you learn a ton of things that you just wouldn't learn anywhere else unless you're working as an MA or, you know, an RN or something like that. But of course those require advanced education more than as a scribe, so this is a way to get your foot in the door with some clinical experience, and it does count as clinical experience on your application, and you get paid for it, so hey, what's better than that, right? So basically, scribes are utilized in the ER for the main majority of scribing is done in the ER. That's where it started out. That's just how it goes. But recently they have spread scribes to other specialties such as OBGYN, geriatrics, primary care, dermatology, you name it. So we're expanding our field as far as that goes. I personally started off in the ER, and I still work in the ER sometimes. Now I've been working more with WellMed, which is a geriatric clinic. That's in Texas and Florida, I believe. So I'm on assignment right now for that. And I love working as a scribe. In the ER, it's an adrenaline rush every day. You see crazy things. And you just learn a lot from your physician that you work with. Typically in a day, it can range from just a few patients to many patients, just depending on how busy it is. And sometimes the bad thing is, like, maybe you won't have time. You're not going to get like an hour lunch break like you will with some 9-to-5 job. You'll be working 8 to 12-hour shifts, just depending on the company and location. And if patients keep coming in, then you keep seeing patients with a physician. So essentially, you go into the patient's room with a physician. You write down all of the pertinent information in the encounters. You write down, when the physician is examining the patient, you write down those findings. They usually yell it out to you in the room. You kind of discuss everything with the physician afterwards and either write it on a T-sheet, which is a paper form that they use, or you use a electronic medical record system, such as an RER. We use Pisces. Once again, this all varies based on company, location. Just from my experience, this is what I've done in the ER. Working at WellMed is a little different. It's geriatrics, so it's chronic care visits for the most part. So it's not, in and out like the ER is. We do see the patients for longer times. We do have a set schedule with an hour lunch break, so that's nice. And the difference there is, as a scribe, you chart more than you would in the ER. For instance, instead of just doing the HPI, ROS, and physical exam with maybe some labs here and there, at WellMed, we do all of that. And in addition to that, we pull in assessments. So if the patient has diabetes, for instance, we'll pull that in with any manifestations that go along with that, such as like polyneuropathy or chronic kidney disease, whatever. And then we also chart the treatment plan, which is when the physician tells the patient what they're going to do about their diabetes, like start metformin and check your blood sugars, twice a day, etc., etc. We are charting that as well. So it's kind of nice because you kind of learn how from a physician's point how they are going to treat each assessment or diagnosis, and you kind of, start to pick up on that so as you see them more, as well as ordering labs, diagnostic imaging, and procedures that the physician is ordering for each patient. We put that in as well. Starting new medications, new prescriptions, refills, we do it all. So it's really nice. I've learned a ton working at WellMed, and I just really enjoy being a scribe, and I don't think that I would have known half the stuff that I know today without having been a scribe. So I definitely recommend it. If you have the time to work a little bit while you're in school or while you're still whatever it is that you're trying to get into, I definitely would recommend becoming a scribe. So if y'all have any questions about how to become a scribe, anything more that I need to go into detail further for you, feel free to comment below and reach out to me, and I have no problem answering any questions that you guys might have. Once again, I'm so sorry that it took me forever to post another video, but I will be posting another one soon, hopefully on the topic of an update video, because I do have some really good news to share with you all. Which I will share in the next video. So please don't forget to subscribe if you're not already, and look out for more videos on the way. Thanks, guys. Bye.